So this video went viral on TikTok, and as someone who works in a healthcare setting, I wanted to talk about this and the fact that we continue to see unethical behavior posted online by healthcare workers. Now, the people in this video were employed by Premier Dental Group in Knoxville, Tennessee, and from what we hear, a patient left their journal at the office. And not only did they read it, but the individual recording decided to share it on the social media platform Snapchat. So as it says, found a patient's journal and now it's story time. LMFAO, which means laughing my effing ASS off, which really there wasn't anything funny about what was being said from what we could tell from what was read. It sounds like the patient was just journaling and writing out their thoughts. There was some mention of, I want to say, radiation. So, whoever this individual is, they are going through probably a really rough time in their life and maybe going through counseling and advised to journal, or just finding that journaling kind of helps them get through whatever it is that they're dealing with. So instead of just calling the patient to let him or her know that their journal was left in the office, they decided that it would be, funny to have story time and to post some private details of this person's life on social media. Now, someone, when they shared it, they made this comment. The individual starts off by saying, "I was waiting to post this so I could talk to the office manager. 3 employees at Premier Dental Group of Knoxville decided to go into the manager's office after a patient had left their personal journal and get the journal and read it. Not only did they read it, they recorded it and thought it was quite comical as they read aloud about this lady's health issues. It's pretty disturbing that these girls thought this was funny, and to think they handle patients' private information every day. So there's no telling what they're doing with everyone else's personal information." They said, if this is your dental office, I would suggest switching dentists. That isn't okay. They said you take an oath in the medical field, and these girls clearly disregarded that oath. Now, a local news station there in Knoxville did pick up this story, and I guess this is not the first time this office has had some issues, ethical issues. So let's take a listen to what the news station had to say.
Knoxville faces new scrutiny after a video posted online shows staff reading aloud from a patient journal.
10 News anchor Brittany Bailey joining us from the newsroom with the response to that video, and that appears now, Brittany, to have been deleted.
Robin and John, that is right. Take a look at what happens if you try to open the Facebook page to Premier Dental Group of Knoxville. Before the post was removed, we did take a screenshot after it was shared. Many of you also reached out and shared the Facebook post and the video with us. Well, the video in question shows employees reading out of a patient's journal. We are not showing the video because of privacy concerns. The journal has information about the patient's health. The employees then posted that video to Snapchat. On Facebook, the post from Premier Dental Group says the office is aware of the video. Those behind the post said they deeply regret the incident and apologize to the people affected. They say they initiated an investigation and the employees were addressed. The company is now reviewing internal policies and training procedures. Now, we did try to call the group, but got no answer.
It is not the first time this group has faced scrutiny.
It is not. Last October, you may remember, we learned the U.S. Attorney's Office reached a settlement with this group. The 2020 lawsuit alleged the provider tried to falsify TennCare claims by using unqualified dental hygienists and treating patients like so-called cattle to maximize profits. 2 whistleblowers also claimed the company submitted billing codes on the amount of sedation used on children in ways that could have possibly killed or hurt patients. The group did agree to pay nearly $1 million to resolve those allegations. John and Robin.
So that was just 2 years ago. So you had unlicensed dental hygienists performing services on patients, and you're submitting sedation codes that are not appropriate for children. So it's just downright scary. But a lot of people weighed in on this, and someone commented and said that the woman they were talking about had cancer, and she was talking about whether she wanted to continue treatment or not. It was heartbreaking what she was writing to begin with, and they were laughing about it. And clearly, there was nothing funny about what was being said. Someone else commented, they said, I worked at a dental office. Every morning we had a meeting. That was when they would gossip and laugh about the patients coming in that day. That is just downright, it's scary that, these people, your life is in their hands, and everything to them is just funny. Now, someone says, what a liability this place is. Addressed but not fired. So they said they addressed the staff, but everyone is saying that they should have been fired. Someone did come out and state that they did hear that they were fired, but some people aren't believing it. This person went on to say they need to make an example out of them a second time in the media. How shady is this dentist office to put children at risk for greed? Now, in regards to the staff's apology, a lot of people felt like they weren't really sorry. And this apology is only put in place because they got caught. But what would make an individual go inside their manager's office to retrieve a patient's journal just to read it and record it and share it online? I mean, it's just some of the stuff that young people do. It's just a lot of stupidity. But someone says on Yelp that the dentist office blocked their reviews. They said, I hope that place shuts down and everyone involved has to work somewhere else. The names should be shown. So let me know in the comments your thoughts about this whole situation. And if you were in this patient's shoes, how would you feel if your personal information was shared publicly online? And also, do you think there are other ramifications for their behavior? I want to know your thoughts, you guys. And as always, I thank you all for watching and listening, and I'll talk to you in the next video.
2 new ones, which are dermal, so they are not risking anything. I'm going to continue in testing and the next, but my views have not changed on treatment. I'm not going to do any dialysis, chemo, radiation, or